Hi, everyone. It's great to have you here. I'm Teresa Youngkin, and I'm deeply committed to bridging the gap between healthcare and technology, making it accessible and impactful for all. So you're going to find me here helping healthcare leaders stay ahead of the curve when it comes to new technologies by simplifying those tech concepts into business-oriented language. So whether you're struggling with data initiatives or you're trying to make informed decisions about new technologies, either to incorporate or to bring into your existing workflows, or just dealing with the constant changes in the market because there are so many right now, we've got you covered. Well, I'm really excited to talk about the HL7 FHIR Connectathon that was held in September. It brought together organizations across healthcare to test real-world implementations of FHIR standards for data exchange. Now, this was more than 65 organizations, and it went over 38 use cases, and it was an incredible demonstration of the potential that FHIR holds for the healthcare industry. Now, we witness these organizations coming together to push the boundaries of interoperability. And this number does not include the additional providers, payers, and vendors that were also present, who were there as presenters, or they came to listen and learn. So FHIR is the thing. You know, FHIR is mandated, it's been written into rule, and it's going to start picking up and moving forward. Now, this particular event highlighted the momentum between the adoption of FHIR-based APIs and interoperability. And there were a few key themes that stood out among the wide variety of use cases that were there and that we're demonstrating and testing. The first one I want to talk about is empowering patients. That's one use case, like the International Patient Access, International Patient Summary, and the Advanced Directive Interoperability. Now, those focus on putting healthcare data directly into the hands of patients. And the University of Washington showcased an app that was merging data from multiple providers, APIs, into a consolidated international patient summary, and patients can access that via a QR code. Why is this important? Because we are now becoming more location independent. We're becoming more digital nomads. And as you travel both internationally and domestically between state to state, this is going to be very important, especially around advanced directives. So next, closing clinical care gaps. Well, these Da Vinci use cases are advancing payer-provider data exchange to improve outcomes. One of the discussions that was there, they didn't necessarily test, was the risk adjustment track addressed providing clinical evidence to payers to close coding gaps in risk adjustment reports. Very important, especially if you're a Medicare Advantage organization. Now, the burden reduction track, and we're all about the burden reduction track because it has been written in a reg, that brought the payers, EHR vendors, and digital health companies together to demonstrate streamlined prior auth workflows. Very important. Another use case was the automating quality reporting tracks. So those were like clinical reasoning, like the OMOP CQL FHIR initiative. Those highlighted new approaches to defining electronic clinical quality measures for EHR calculations and reporting. We all know that this can be very stressful for providers to do. It's really, it's another one of those areas that could be improved for payers as well in any sort of network agreement. Now, there was strong engagement from the governmental agencies who write these standards. There were a lot of measure stewards there and health IT vendors that were collaborating on this very complex challenge. If you've ever done electronic quality measure reporting, you know that this is a challenge no matter where you are in the business operations of trying to gather that data, analyze that data, and report it back. So the other one that I really want to talk about too is the advancing public health use cases. Now, they were working around aligning and optimizing, aggregating data. They also worked on PDMP, which is the Prescription Drug Monitoring Program, having that on FHIR. And others focused on applying FHIR to public health needs like newborn screenings, infectious disease surveillance, and again, like I said, PDMP. Now, the CDC and other agencies provided some real-world insights on the current limitations and the future potential of using FHIR. So it's not just that we're coming to test at these connectathons and at these gatherings. It's really about sitting down and talking so that all the collaborators can get together, all the stakeholders get together, and then we can have informed we can have informed discussions to make informed decisions about how the standard should operate. We learned way back in the late 2000s. I'm sorry, I guess like in the late 2000s, right? 2008, 2009, 2010, when we went on to EHRs, about needing to have those that are at the end of the workflow, those that are at that last mile who are actually using these tools, to be voices, because we can't develop in a black box with no other interventions. And that's one of the beauties of Da Vinci, is really bringing stakeholders and organizations are actually using these technologies together to get the best practices put into our workflows and into these technologies and into the standard. Sorry about that, because I'm very excited about this. Now, we saw strong engagement when it comes to Da Vinci's representation at the Connectathon across the payers, digital health vendors, the EHRs, and the providers. And here are a couple of examples of some of the really, really good work that went on during that time. Epic, EdFX, and Smile Digital Health worked together on the burden reduction track for coverage requirements discovery, CRD, prior authorization support, PAUSE, and DTR, which is documentation templates and rules testing. That was a really great demo. Aetna, Humana, Optum, and Change collaborated on standards-based clinical evidence exchange, and that was across different groups that were testing there. Lantana and EdFX tested the payer cost transparency implementation guide. Very, very important and top of mind for many organizations, this data exchange. Now, these events accelerate learning across the healthcare ecosystem on what works, what doesn't work, and how to maximize the value of FHIR for solving real healthcare problems. That's the value of these types of, like I said, these types of events. Now, the feedback that's gathered at these Connectathons doesn't just get left there. It actually continues to shape these implementation guides and the adoption of modern interoperability standards. So, we get together, we talk about it, and then we go back and we develop around it, right? This is real agile development with input from stakeholders and from people who have a dog in the hunt, if you want to call it that way. So I really would encourage anybody who's out there thinking about participating in Da Vinci to attend one of the public meetings. You can find it on Confluence. There are all the public meetings you're able to come to. Sit down and have a listening session. If you're the business owner that's there, I would encourage you to not think of this as just an IT exercise, because it is not. We need to have the business there telling us exactly what their challenges are and exactly what they need in workflow to accomplish their strategic objectives and to use FHIR to its highest and most important standard. So, like I said, it was a great time. I came back super energized because of the fact that we, in the value-based performance reporting IG, which I'm a part of, we had a chance to sit down and talk and actually make connections with others. And there was one actual partnership that left that weekend, or those 2 days, I should say, and are now working collaboratively to be testing. So would love to talk to anybody who wants to talk about Da Vinci or about what any of these use cases are. I can get you pointed in the right direction. Please reach out to me. This is very important. If you don't know, FHIR is being named in more and more standards. So this is why it's important for you to be involved now and not later. So thank you so much. I'm really glad. I hope you take me up on the offer just to find out a little bit more about FHIR, about Da Vinci, about HL7, standards-based interoperability. Love anything that has to do with any of those areas, as you know. And I will be back here next week to talk about the latest developments around AI, because there have been many announcements over the past couple of weeks and how it can benefit your organization. We're also going to always keep in mind the 4 Ds of data, right? Data quality, data interoperability, data transmission or data sharing, if that's what you want to call it. And lastly, data governance. That will always be weaved in and out of these discussions, because at the heart of this, we always know that none of these initiatives work if we don't get the data that we need to benefit our organization. And that's why I'm here every week talking about it and weaving in those data conversations because it is ever so important. So again, thank you so much. And I will see you guys here again next week where we're going to have another conversation, like I said, about generative AI, because there just have been so many new updates and announcements. So we'll see you then. Bye. Have a great week. Bye.